Imagine waking up one morning with severe chest pain, rushing to the emergency room, and then surviving the medical emergency only to receive a bill weeks later that's higher than your annual income. This is not a movie scene. This is real life for millions of people in the United States. In America, getting sick is not just a health issue. It can become a financial crisis overnight. A simple ambulance ride can cost hundreds or even thousands of dollars. A short hospital stay can drain your savings, and a major surgery can put families into lifelong debt. Yet, despite these risks, many people still don't fully understand how health insurance works, why it's so expensive, or how to choose the right plan. The system feels confusing, full of strange words, hidden rules, and fine print that most people never read until it's too late. That confusion leads to fear, wrong decisions, and unnecessary financial loss. But what if you could finally break through that confusion and take control of your healthcare choices instead of letting the system control you? Health insurance in the United States is not just a piece of paperwork or a monthly bill, it's a safety net that protects you from financial disaster when life takes an unexpected turn. Whether you are a student, a working professional, self-employed, unemployed, an immigrant, or supporting a family, health insurance plays a critical role in your life. In this video, we are going to simplify the entire US health insurance system step by step in plain and easy language. You will learn why healthcare costs are so high in the US, how health insurance actually works behind the scenes, what all those confusing terms really mean, and the different types of insurance plans available. Most importantly, you'll learn how to choose a plan that fits your needs and budget, and how to avoid common mistakes that cost people thousands of dollars every year. By the end of this video, you won't just understand health insurance, you'll feel confident making smarter decisions that protect both your health and your money. Why health insurance is critical in the USA. In the United States, healthcare is one of the most expensive systems in the world, and this is the main reason health insurance is not optional but essential. Unlike many countries where the government covers most medical costs, in the US, you are personally responsible for paying medical bills unless you have insurance. Even a routine doctor visit can cost between $150 to $300, while emergency room visits often start from $1,000 and go much higher. A single night in a hospital can cost several $1,000s, and major surgeries can reach tens or even hundreds of thousands of dollars. These costs do not include medicines, lab tests, or follow-up visits, which add even more financial pressure. Without health insurance, people often delay seeing a doctor because they fear the cost. This delay can turn small health problems into serious and life-threatening conditions. Many Americans without insurance avoid preventive care such as annual checkups, screenings, and vaccinations, even though early treatment is always cheaper and safer. Health insurance encourages people to seek care early, which protects both their health and their finances. Another critical reason health insurance matters is medical debt. Medical bills are one of the leading causes of bankruptcy in the United States. Even people with decent incomes can face financial ruin after an unexpected illness or accident. Health insurance helps limit this risk by sharing the cost between you and the insurance company. Instead of paying the full amount, you pay a smaller portion, while the insurer covers the rest. Health insurance also provides access to a network of doctors, hospitals, and specialists. Without insurance, finding quality healthcare can be difficult, and some providers may refuse treatment unless it's an emergency. In short, health insurance in the USA is not just about staying healthy, it's about survival, financial stability, and peace of mind. How health insurance works. Health insurance works on a cost-sharing system between you and the insurance company. Instead of paying all medical expenses yourself, you pay certain fixed amounts, and the insurer pays the rest. The first key term is the premium, which is the monthly amount you pay to keep your insurance active, whether you use medical services or not. Think of it like a subscription fee for protection. Next is the deductible, which is the amount you must pay out of your own pocket before your insurance starts covering most services. For example, if your deductible is $2,000, you must pay the first $2,000 of medical expenses yourself before the insurance company begins to share the cost. Then comes the copay, which is a fixed amount you pay for specific services, such as $25 for a doctor visit or $10 for a prescription. Copays usually apply even after you meet your deductible. Coinsurance is different, it's a percentage split of costs between you and the insurer, such as you paying 20% and the insurance company paying 80%. One of the most important protections is the out-of-pocket maximum. This is the highest amount you will pay in a year for covered services. Once you reach this limit, The insurance company pays 100% of covered medical costs for the rest of the year. This feature prevents unlimited financial loss during serious illness. Understanding how these elements work together helps you predict your healthcare costs and avoid surprises. Many people choose plans without understanding these terms and later regret their decision when bills arrive. Types of health insurance in the USA. There are several ways people get health insurance in the United States. The most common is employer-sponsored insurance, where your job provides health coverage and usually pays part of the premium. These plans are often affordable and offer good coverage, but you lose them if you leave your job. The second major category is government programs. Medicare is designed for people aged 65 and older, and for some younger people with disabilities. It covers hospital care, medical visits, and sometimes prescription drugs. Medicaid is for low-income individuals and families, and eligibility depends on income and state rules. CHIP, the Children's Health Insurance Program, covers children from families that earn too much for Medicaid but still need assistance. Another major option is Marketplace or ACA plans, often called Obamacare. These plans are available to individuals and families who don't get insurance through work. Depending on income, people may receive subsidies that significantly lower monthly premiums. These plans must cover essential health benefits like hospital care, maternity services, mental health treatment, and preventive care. Finally, there are private and short-term plans. These are usually cheaper but offer limited coverage and may exclude pre-existing conditions. While they may work for temporary situations, they carry higher risks and fewer protections. Types of insurance plans explained. Health insurance plans differ based on how flexible they are in choosing doctors and specialists. HMO plans require you to choose a primary care doctor and get referrals to see specialists. They are usually cheaper but less flexible. PPO plans offer more freedom, allowing you to see specialists without referrals and visit out-of-network providers, but they cost more. EPO plans combine elements of HMO and PPO plans. They don't require referrals but only cover in-network providers. Post plans require referrals like HMOs but allow some out-of-network coverage at higher costs. Choosing the right plan depends on your health needs, budget, and preference for flexibility. People who want freedom usually choose PPOs, while those focused on saving money often choose HMOs. How to choose the right health insurance plan. Choosing the right plan starts with understanding your healthcare needs. If you are healthy and rarely visit doctors, a plan with a lower premium and higher deductible may work. If you have chronic conditions or frequent medical needs, a higher premium with lower out-of-pocket costs may be better. Budget is another major factor. Look beyond the monthly premium and calculate total possible yearly costs. Check whether your preferred doctors and hospitals are in-network. Families should consider maternity care, pediatric services, and prescription coverage. Always read the summary of benefits carefully and compare multiple plans before deciding. A few extra minutes of research can save thousands of dollars later. Common mistakes people make. One of the biggest mistakes is choosing the cheapest plan without understanding coverage. Low premiums often mean high deductibles and limited benefits. Another mistake is ignoring network rules, which can lead to expensive out-of-network bills. Many people miss enrollment deadlines and are forced to wait months for coverage. Others don't use free preventive services included in their plans, missing out on early detection of health problems. Understanding these mistakes helps you avoid financial stress and use your insurance wisely. Health insurance is not just about having a card, it's about knowing how to use it effectively. Health insurance in the United States can feel overwhelming, confusing, and even intimidating. But the truth is that once you understand how it works, it becomes a powerful tool rather than a burden. Throughout this video, we've seen that health insurance is not just about paying monthly premiums or dealing with paperwork. It's about protecting yourself, your family, and your future from financial shock. Illness and accidents don't come with warnings, but being prepared gives you control in a system where medical costs can otherwise spiral out of control. When you understand your plan, your coverage, and your rights, you stop reacting in fear and start making confident, informed decisions. Remember, the goal is not to find the cheapest plan, but the right plan for your life. Your health needs, income, family situation, and future goals all matter. A few minutes of research today can save you years of stress and thousands of dollars tomorrow. Health insurance is one of the smartest investments you can make, not because you expect to get sick, but because life is unpredictable. When something goes wrong, the right coverage can mean the difference between recovery and financial hardship. If this video helped clear your confusion, take the next step. Review your current plan, ask questions, and don't be afraid to compare options. Knowledge is your strongest protection in the US healthcare system. If you found value in this explanation, support the channel by liking the video, subscribing, and sharing it with someone who might be struggling to understand health insurance. And if you have questions or want deeper videos on topics like lowering insurance costs, plans for immigrants, students, or self-employed workers, let me know in the comments. Stay informed, stay protected, and take control of your health and your financial future.